Great. So thank you for this opportunity today to talk about the overview of primary immune regulatory disorders, or PIRD. So for today's talk, our roadmap is going to be first talking about the different types of immune system problems, and then we'll kind of go through the definition of PIRD, clinical features that you'll see, causes of PIRD, and then we'll go through some classic examples of PIRD disorders. We'll touch broadly on different types of PIRD therapies, and we'll also then end with sort of what's new on the horizon for PIRD in terms of new types of research that's happening. So there are, broadly speaking, two types of immune system problems, and sometimes this can be called inborn errors of immunity. And so what we know based on the latest publication is there are roughly 430 genes that can cause immune system problems. And within those 430 genes, it can be divided into two categories. So roughly 2/3 of the genes are known to cause problems with infections. And so this is called primary immune deficiency disorders, or PIDD. And the patients oftentimes have problems with an underactive immune system, such that they get a lot of infections and they require treatments to prevent infections to keep them well. The other types of disorders are called immune dysregulation, and they're called primary immune regulatory disorders, or PIRD, and they represent roughly 1/3 of the genes that are known to cause immune system problems. And these patients oftentimes have an overactive immune system, such that the immune system is attacking different parts of the body. And these patients oftentimes need medicines to suppress the immune system, or immune suppressive therapies. So what is a PIRD? Well, a PIRD are diseases that are due to a breakdown in the regulation of the immune response. And so what I think about, it's kind of like a thermostat, the immune system. So we don't want the thermostat to be cold, where the immune system is just sitting around, not doing anything, bundled up in blankets. An infection comes along and it's like, okay, go for it, attack the body. And then on the other side, we don't want the immune system to be overactive, where it's super, running around, attacking different parts of the body and causing a lot of damage. We really want the immune system to be just right, sort of in that sort of cool, warm spot where, it's able to, turn up and down the immune response as needed, depending on, what's causing problems for the body. And so these patients can present with features like autoimmunity, inflammation. Sometimes it's called autoinflammation or hyperinflammation. Sometimes patients can get a lot of infections. They can develop lymphoproliferation, and what that means is basically the immune cells are expanding rapidly, even though it doesn't need to be expanding rapidly. Patients can develop malignancy or cancer, because we know that the immune system is important for going around the body and sort of getting rid of bad cancer cells that may develop. And so if it's not, acting properly, cancer and a malignancy can develop. And some patients can also develop pretty severe atopy or allergies, because it's not able to when it senses those environmental triggers, it's not regulated properly and goes crazy. And so what are clinical features in PIRD? So this is sort of a relatively new category of diseases. And so when we started to learn about this group of disorders, we surveyed roughly 30 plus centers in the US and in Europe, and asking providers or doctors, what sort of patients do you think have PIRD? And then amongst those patients, we got roughly a little over 200 patients. We asked, well, what types of symptoms do these patients get? And so at the top, we talked about we highlighted the 4 broad categories of clinical features. So autoimmunity, autoinflammatory disorders, immune deficiency, or lymphoproliferation. And what we found in these PIRD patients that these providers refer to as roughly 75% have autoimmune features, and 68% have immune deficiency features. And so it's really not the classic primary immune deficiency, but really a mixture of both an overactive and sometimes an underactive immune system problem. We also found in these patients that we surveyed that, patients with PIRD can actually have an impact on all the organs of the body. Most commonly, patients would have gastrointestinal symptoms, so problems with the gut, such as with diarrhea. Roughly 72% of patients had GI problems, but also a common problem we're seeing in the skin as well as in the blood disorders or hematologic problems. But various different organs can be affected in patients with PIRD. So what causes PIRD? Well, from our survey, we actually found there are a whole slew of genes that could cause a clinical phenotype of PIRD. We found all of these genes shown here. And when we looked at the different types of genes that were associated with this PIRD phenotype, we found that these genes actually played a role in many different types of immune pathways that regulate the immune system. And so that's why they can develop features of overactive and sometimes features of an underactive immune system problem. So how do you get PIRD? Well, one, you can have inherited from your biological parents. So sometimes only one change is needed to develop a PIRD disorder versus sometimes you have to have two changes. So one change from your mother and one change from your father. Some of these PIRD patients actually arise from a spontaneous change, meaning that neither their biological parents had the change, it just happened spontaneously. And so these are called de novo changes. And this can also happen in patients with PIRD. So now let's talk about we'll go through different examples of PIRD disorders. So the classic PIRD is actually IPEX. So IPEX stands for immune dysregulation, polyendocrinopathy, enteropathy, and X-linked disease. So this is a disorder due to changes in the FOXP3 gene. And FOXP3 is an important gene that controls the development and function of T regulatory cells. So regulatory T cells or Tregs are an important immune cell that goes around and sort of controls the immune system, telling it when to stop and when it can go. And so when you have problems with how these cells are functioning, then you have problems with the immune system potentially attacking the body. So the classic symptoms include diarrhea. So patients can develop poor growth. They can have rashes. The most commonly seen is eczema. And patients can also develop type 1 diabetes, where the immune system is attacking the pancreas. Another type of PIRD is called CHI, which stands for CTLA4 haploinsufficiency with autoimmune infiltration. And this is basically due to changes in a gene called the CTLA4 gene. And what happens is that when you have changes in the CTLA4 gene, you lose the ability to control an active immune response. So take, for example, an infection where the immune system gets revved up. You don't have that ability when the infection is gone to try and turn down the immune response. And so the immune system can go active and attack different parts of the body. And so the figure here on the right side shows the different types of problems that can happen in the body due to the immune system attacking different parts. So the common things that we see in these patients is they can develop big lymph nodes or spleen or splenomegaly, and this is due to lymphoproliferation, where I was saying that the immune cells sort of are increasing in numbers, even though they don't need to be increasing in numbers. Patients can develop diarrhea, where the immune system is attacking the gut, and so they're losing, their problems and they get a lot of diarrhea that happens. They can have attacks on their lung and develop a lung disease. They can also attack different parts of the blood cells, such as your red blood cells and platelets, and cause anemia or low platelet counts. And some of these patients also have very low IgG or antibodies, and this causes them to be at risk for different types of infections. So another type of PIRD is called STAT1 or STAT3 gain of function diseases. So these are due to changes in either the STAT1 or the STAT3 protein. And so what are these STAT proteins? So the STAT proteins are in the cell and they're important for for deciding when an immune cell become active. And so they take signals from the outside of the immune cells and they translate it. The signals get translated and turn on these STAT proteins. These STAT proteins then go into the nucleus to the DNA and turn on different genes. And sometimes when they're not behaving correctly, these STAT genes turn on genes that cause the immune system to be very active and abnormal and cause an immune system storm. And it causes the immune system to attack different parts of the body. So, for example, in STAT1 gain of function patients, some patients can actually develop chronic mucocutaneous candidiasis. So this is a type of candidal or fungal infection that develops in the mouth, and they can develop a lot of inflammation from it and get a lot of mouth sores. Patients can also develop a lot of autoimmune problems, such as attacks on the gut, and develop a lot of diarrhea. Um, in the case of STAT3 gain of function patients, patients also can develop diarrhea. So similar to STAT1, their intestines are being attacked by the immune system, and so they have poor growth. The immune system can also attack different parts of the blood counts, so they can have low red blood cells and low platelets from it. And these patients also can develop big lymph nodes and spleen or splenomegaly because the immune system is so active and it's just growing, growing, growing uncontrollably. So these are some of the different types of symptoms that can be seen in either STAT1 gain of function or STAT3 gain of function patients. So broadly speaking, what are the different types of PIRD therapies that are used? So in general, we talked about how for PIRD, the immune system tends to be more overactive. And so oftentimes we need medications to suppress the immune system. The most common one that we probably use is steroids because it acts fast. It can be easily given to patients. But the problem with steroids is if you need it high doses for a long period of time, there can be a lot of, bad side effects from being on steroids. And so these patients oftentimes need another type of medication, what we call steroid sparing agents. And there are a variety of different types of treatments. Some are monoclonal antibodies like TNF inhibitors or rituximab. Sometimes there are small molecule targets such as DAC inhibitors like tofacitinib or ruxolitinib. And these are medicines that are not steroids that are able to decrease the immune system response. Some of these patients also need immune protective medicines, kind of like in the primary immune deficiency disorders, because the combination of their immune system problem plus being on immune suppressive therapies makes them at high risk for developing different types of infections. And so sometimes we put patients on antibody replacement like IVIG or sub-Q IG. Some of these patients also get placed on antibiotics or antimicrobial therapies to either prevent different types of infections or treat different types of infections if we're starting to see problems. And lastly, some of these patients actually require immune system replacement, meaning we take out their immune system and put in a whole new one, whether that's via bone marrow transplant or hematopoietic stem cell transplant, where we take out the bone marrow cells and with the old immune cell type that has a problem, put in a new immune system, develop a new immune cells that won't attack different parts of the body. And lastly, I just want to end with sort of what is new or what's on the horizon for PIRD disorders. Well, one of the big studies that we're about to start on is trying to understand the natural history of PIRD patients. So this is a protocol that will be opening up soon based out of the Primary Immune Deficiency Treatment Consortium, or the PIDTC. And basically what we're going to be doing is collecting all the patients that have PIRD and really understanding how does this disease develop. So when patients are born, what symptoms do they have? And as they grow older into adulthood, how does this disease evolve? How do we know which types of therapies are good for some types of diseases and which types of therapies may not be good? And which patients may need an immune system replacement or a transplant to really help them, sort of continue on to adulthood with the least number of side effects. So that's one of the big studies that's going to be opening up, hopefully within the fall of 2021. And there are always new PIRD genes being discovered. I would say there's probably one new gene mutation that's being reported every, couple weeks to a couple months. And so I tell, my patient, I think about these new genes in my patients that I suspect have a PIRD disorder, but we don't quite have a genetic defect. And so there's always new genes being discovered. And lastly, there are a whole bunch of new therapies because as we figure out the exact immune pathway that might be problematic, there are drugs that we can develop to target that specific pathway to correct it, to get that immune system back into the right balance where it's not too hot and not too cold, sort of just at that right amount. There's also a lot of gene therapy trials that are going on for different types of genetic defects. And certainly what's up and coming in the future with all the CRISPR and Cas9 is sort of gene editing, where we can sort of change that specific, mutation in the immune system and correct it to the correct one so that the immune system is able to function appropriately. All right, so just some take-home points from today's talk. So PIRD stands for primary immune regulatory disorders. These are diseases caused by the breakdown in the regulation of the immune response. And so that, we're not able to get that immune system to be right in that perfect window of not being too hot and not being too cold, sort of just right. The patients can develop a variety of clinical features, so autoimmunity, inflammation, infections, lymphoproliferation, malignancy or cancer, and also severe atopy or allergies can be seen in these patients. There are a whole slew of genes that can cause PIRD, and they're all usually in pathways that regulate the immune system. And lastly, there are a variety of different therapies, but because in general, PIRD disorders are due to an overactive immune response, oftentimes immune suppressive medicines are needed to control or bring the immune response back down. But these patients can also be at increased risks for different types of infections. And so sometimes we put them on immune protective medicines. And lastly, some patients really require a replacement of their immune system to really fix their immune system problem, whether it's through a bone marrow transplant or hematopoietic stem cell transplant. Well, thank you for your time today. I hope this information will be helpful to you and happy to take questions.